Is this on? Is it working? We at it? You guys hear me? All right. Well, welcome. This is the inaugural, as was mentioned, this is the inaugural policy and practice event for the Civic Federation. The Civic Federation, as kind of was alluded to by Ellen, has been going through what do we do? How do we make sure that all of what it is that the Civic Federation, and I'm on the board, as is Mark. So when I say we, I am talking about the Civic Federation collectively. How is it that we can make sure that you really get a sense of what it is that they do? So you can talk about policy, you can talk about all that. It is accessible. I will say I recently benefited from the great policy work that Civic Federation has put together, the conciseness, all the papers that you can go online and see. I moderated a very similar panel a few months ago for the Women Leaders in Philanthropy, which is a giving group of Oak Park River Forest Community Foundation. And in doing so, I wanted to prep myself for how I was going to talk with these leaders about how the federal policy implications are happening. I did, Googled HR 1, the one big beautiful bill. How does that impact what's happening here locally? And what came up were the policy papers of the Civic Federation. I was Googling early childhood education because that too was a subject of our conversation. And up came a paper from the Civic Federation. So it is a great resource that we have. And the benefit of a strategic planning process that we went through not too long ago was one focus area of reimagining engagement. That's why we're here. It's the staff who said there's got to be a way for us not only to produce the policy papers, but to make it more real for us, for all of you, for everybody, the public inclusive, not only members, but how can we make the public more aware of what it is that is happening from a policy perspective and making it real. And that's why we are here. We have leaders in the area to be able to really bring it home for everybody. And of course, being the Civic Federation and us focused on that fiscal policy, we recognize and acknowledge that not only are we in this moment, but it's unfolding in a state and local fiscal challenges that we have, an environment that's already constrained. Illinois and Chicago face significant fixed costs through the pension and debt, as well as existing budget gaps, even before we start accounting for the federal changes. So today we're really about how is it that we can bring this down so that each of you can understand it through the leadership, specifically within the human service organizations. Some of you may be very well aware of the different human service organizations that are going to be impacted, but some of you may not. And so we're going to bring that to light today. We have three panelists. Each are going to bring their own perspective, although they could speak to any of these perspectives, but we're going to have each of them tackle one because we know having several people answer the same question is sometimes not as helpful as one each going down deep. So we're going to speak to what's actually changing on the ground, where strain compounds from system intersections, and then where Springfield decisions matter most. I'm glad that they're in this order. I'm going to ask each of them in this order to be able to introduce themselves, their organization, which perspective they're going to cover, and then I'm going to start the questioning. So Mark, do you want to start?
Okay, sure. And we're just doing introductions
now.
Okay. Yep. So I'll be as brief as I can. I'm Mark Ishaug, though my tag says Joe Ferguson, which I love. They were saving money and they printed my name on the other side of his. So as a very proud and fiscally responsible board member, I thank you, Joe, and the team who put this together. Mark Ishaug, President and CEO of Thresholds. We're a very large community mental health and housing organization. We've been around for almost 70 years. We were founded in 1959 by, records are a little complicated, but it's between 5 and 12 Jewish women from the National Association, is that the National Council of Jewish Women? You're on the National Board, okay, well, there you go. It was the Chicago chapter. And in 2019, right, actually just months before she died, I met one of the founders, a woman named Leona Rosenberg, and the last survivor of the founding board of Thresholds from 1959. And I had lunch with her in Chicago, and she was delightful. She was, I think, 99, or maybe she was almost 100 when I met her. And I just asked her, I said, why? Of all the things you could have done in 1959? And without missing a beat, she just said, there was a need and we were determined to meet it. That was it. And it really, I think it speaks to what Thresholds is today. Our mantra is, well, we have a bunch, but mine are, we lead with love, we show up, and we fight like hell for what is right. And those are the three principles that guide us. What we do is provide home, health, and hope to thousands, about 13,000 people a year living with serious mental illness, homelessness, pretty serious substance abuse challenges, and almost all of whom are living in poverty. We provide housing and healthcare and psychiatry and psychology and case management and employment, everything that we can do to help people reclaim their lives, because one can recover, quote unquote, with a serious mental illness, and that is our mission. And finally, we do everything possible to keep people out of institutional settings, the institutions of homelessness, the institutions of nursing homes, the institutions of hospitals and ERs, and of course, the institution of jail and prison, where far too many people with substance use and mental health challenges end up. And we are the antidote to all of that.
Morning, everyone. Is this on? There we go. Yes. All right. Good morning, everyone. I'm Emily Sweet, Chief Impact Officer at the Jewish United Fund of Metropolitan Chicago. First, I just want to thank the Civic Federation for hosting this conversation. It's very important. Thank you for all of you for showing up this morning and being here, and looking forward to a really great discussion. For those of you that might not be as familiar with the Jewish United Fund, JUF, we are a 125-year-old organization that has always been, from the core of our founding, focused on taking care of people in need throughout the city of Chicago. And through our extensive network of organizations that we fund and support, we touch the lives of about 500,000 Chicagoans of all faiths every year. We provide funding to a really vast network of health and human service organizations that are focused on a variety of issues and services and delivery. So behavioral health, food security, financial assistance, affordable housing support, healthcare support. And we serve people across the lifespan. So we have programs focused on senior care and Holocaust survivors, to adults and youth and children with disabilities, to victims of domestic violence, to refugees. And one of the things that maybe this group might not be aware of is that refugee resettlement has been a core pillar of the work that JUF has done. For over 40 years, we have administered the state contract for refugee resettlement services throughout the state. So our work is touching all the pillars that are being directly impacted, and I'm looking forward to a great conversation. Thank you.
Thanks, Mark and Emily. I'm very honored to be here with both of you. Hi, everybody. My name is Lauren Wright, and I'm the Executive Director of Illinois Partners for Human Service. I've been in the role for about 7 years, which is pretty minuscule in comparison to my colleagues with a very long and storied and wonderful career history. And Illinois Partners has been around for about 15 years. And we were founded by a group of nonprofits, primarily in the city of Chicago, that really wanted to create a coalition for human services that spoke with a collective voice around the issues that matter to all of us. I think historically, human services, first of all, I think it's a term that a lot of people don't really know what it encompasses necessarily, but it's services across the lifespan. So everything from childcare to care for older adults and all different types of services, of which Emily really named very many of those. And I think historically, human service organizations are community-based, particularly human service organizations, are on the front lines meeting the needs of their communities, but they're also often pitted against each other for scarce resources and made to believe that if you get a bigger slice of the pie, then my slice will be smaller. But actually, what Illinois Partners is here to do is grow that whole pie and recognize that every single service that community-based providers are bringing to our communities are essential. And so we do quite a bit of policy work in Springfield. We conduct research, which is rooted in the experiences of the providers in our coalition. We have 850 organizations representing every legislative district in the state. And we also have trainings as a part of our organization. But we really stand to speak with that collective voice about the issues that matter to all of us, particularly in moments that require political courage. And we're definitely in one of those moments right now. So very honored to be here.
Great. Well, thanks. I think that you can tell we're going to be hearing from direct service. We're going to be hearing from that intersectionality, and we're going to be hearing what can the state do. So Mark, if you can lead us off and really ground us in what is happening, how is it that HR1 in particular is really that federal policies that seem they're so far away. How are they really showing up in your specific organization? Both how you serve your clients, but then also what's the impact to your staff? What is it that is happening for your organization that may differ because of those federal policies that, again, they seem so far away and yet?
Oh, no, they're here.
Yeah.
The policies are not far away. They're happening as we speak, and we're trying to prevent them from happening as we speak. So I've been doing this, not thresholds, I've been at thresholds for 14 years, but I've been doing health and human service and social justice work forever, probably 50 years if you include my going to boycott Tallman Bank when I was 10 years old because we were fighting redlining in Marquette Park. I didn't exactly know what it was, but my mom was fighting it and she said, "You're coming along and you're holding a sign." And I did. So I don't think Tallman Bank exists anymore, so nobody should be offended by my protest at Tallman Bank 50 years ago. But then for the last 40 years, I worked in Africa on international aid and USAID programs, all of which are being decimated. For 20 plus years, I did work at the AIDS Foundation of Chicago, many years as the CEO. AIDS funding is under attack probably more than any particular subsector of health and human services because it's perceived as DEI and Black and gay and all these things that the current administration detests. And now at Thresholds, community mental health and housing. It's probably after the AIDS Foundation of Chicago, what the current administration is not interested in is mental health, healthcare in general, and housing. So I hate to use the Dickensian phrase, the best of times and the worst of times, but I'll tell you why it feels like the best of times, even though it is truly the worst of times. Because I get to work with you two, right? With Emily and Lauren and Legal Aid Chicago and New Moms is here somewhere and Jennifer, domestic violence. I think I saw Jennifer, Chicago Commons, my own staff from Thresholds who are here today. So I am filled at 63 years old with so much hope because there are hundreds and hundreds of organizations just locally that are making such a big impact with the most vulnerable clients you can imagine. And in addition, changing policies, laws, rules, and regulations at the same time. All of these organizations that I mentioned that are serving clients directly like Thresholds are also fighting the good fight at the city, the county, the state, and the federal levels. So that's why these are the best of times. And I feel in some ways we are more energized than ever. There was a phrase early in my career, silence equals death. I don't know if any of you are from the AIDS world back in the early 90s, late 80s, but that was our mantra. And I use that term every day today, and I've used it for the last 18 months, that we have a responsibility to speak up and speak truth to power. Otherwise, we are going to be squashed, and the people that we love and that we serve are going to be, they're going to be hurt. They're going to die. That is the bottom line. But why these are the worst of times is because everything that we are doing is simply under attack. A couple of months ago, you may have all woken up to a news article about, I think it was I woke up at 4 o'clock, so I read it at 4 o'clock. $2 billion in mental health funding cut. That was it. Everybody was scrambling that day to figure out what programs we were going to cut. And Thresholds were going to have to cut a $200,000 program. Others were cutting their agencies. But through advocacy and media work over 48 hours, all $2 billion in cuts were rescinded. At the same time, housing policies were promulgated to criminalize people that are homeless, to sweep people off the streets and to put them in institutional settings, everything that we've worked against our Threshold's whole existence. And putting at risk in Illinois alone about 40,000 people who currently have housing and 170,000 people nationwide who could lose their housing if these policies go into effect. So you can imagine the impact that this has on Thresholds and on New Moms and on all the staff that are doing this work. As leaders, part of our responsibility is to try to keep people focused on the work. And that's really, really hard because they're reading the same articles and listening to the same newscasts that we are listening to, that I am listening to every day. So really people keeping our staff, we have 1,400 staff and combined we have hundreds of thousands, keeping people focused and doing the good work Because if they stop doing the good work every single day, despite all of these challenges, everything falls apart. So that is really truly the biggest challenge that we have.
Right, so you're seeing this in real time with all of the clients that you're serving and the impacts, as you have mentioned, across the
Yeah.
board. The staff are being affected as well. Emily, I want to turn to you.
When the clients are scared, I just want to add before I
Yeah,
pass it on.
sure.
Because we get calls and emails from them and my staff every day. Am I going to lose my housing? Am I going to lose my Medicaid? I've already lost my food stamps. You know, what do we do?
Yeah.
So
So it's a huge challenge. And Emily, I'm sure that you're seeing it too, that intersectionality, because we know that these policy changes don't happen in a vacuum, right? So you don't see kind of as Mark alluded to, if one is being impacted, there probably are other things. And so if healthcare is impacted, we're going to see that there's going to be some kind of gap in other services, and that's going to again go back and impact the different aspects. So can you share a little bit about, from your perspective, interacting with a lot of different organizations, how it is that those intersections are really providing or creating a lot of strain and pressure?
Yeah, absolutely. And I think the points that Mark made were so spot on and are things that we're seeing across our system as well. I think that just the chaotic nature of the way that policies and executive orders have been rolling out. And it's so expansive. I think, in traditional times or maybe more normal times when there are changes in administration, organizations can do scenario planning. They know whether, new administration's coming in at the federal or state level. You have a sense of, okay, what are programs that maybe are going to be at risk? Maybe there's a specific population that we know, right, that is going to be at risk, or maybe there are some unique opportunities, right, that we might be able to get some additional funding for. And we saw organizations do that scenario planning, but the cuts and the impact are just so expansive. And as you were saying, Kristin, cut across so many systems all at the same time in really rapid pace. It's just creating an incredible strain on the entire ecosystem. I think, for the organizations that we're serving and working really closely with right now, I think the most critical impact for us is around SNAP and the pause in SNAP benefits. And obviously, this is what's going into effect now, and people's ability to access food. And we know that people, when they come into our food pantries, aren't, they have a need for food, but that's usually just the entry point in terms of the needs that they have. And why is it that they need access to food? Perhaps it's because they're dealing with the mental health crisis that required them to take unpaid time off of work and a leave off of work, which is then impacting their ability to pay for their increasingly high cost of rent or medication or healthcare insurance or whatever. There's just, people's lives are complicated, and these issues, especially for folks that are facing financial vulnerability, all intersect with one another. So we really are seeing that impact across the board. I'll just say one of the things with SNAP that has been so difficult about having this program being the one that's targeted at least first is that we know SNAP can be one of the most impactful, food security programs that's out there, and can really help be a program that can keep people housed and, allow people to have extra income to be able to pay their rents and to pay for gas to get them to work and all those different things. And so when there is a fracture across one of these benefit systems, it really has ripple effects across all of them.
Are you seeing any kind of consolidation? Are nonprofit organizations, as they're dealing with all of this, are you seeing any collaboration, consolidations? How else are they, or the organizations themselves, handling that strain?
Yeah, I think absolutely. So there's a few ways that we're seeing organizations respond in this moment. I'm sure Mark and Lauren can speak to this too, just from the personal experience of running organizations. But first and foremost, people are doing scenario planning, right? And they're doing risk assessment, and they're taking really critical look at all the different service lines that they have within their organization, and having to make some hard choices to really think about what is really mission critical and mission aligned, and where might there be opportunities, unfortunately, to either not unfortunately, but to enhance collaboration, right, with other organizations doing similar work, or unfortunately, if we need to sunset some programs. So, organizations now that we work with are doing that kind of calculation. But we are seeing a lot of unique opportunities for people across our system and others of really coming together to think about ways that we can enhance efficiencies, that we can enhance collaboration. So I'll just share 2 examples across the network of organizations that we support. They're looking at ways we might be able to enhance a shared intake process, for example, or shared benefits navigation. Benefits navigation in this ever-shifting climate is tricky, right? And requires a lot of labor on the professional staff and case managers to, as you're like reading the news, like right before this, session of just all the ever-shifting requirements and changes. And so are there ways that we can, really work together across agencies? And it helps create efficiencies within the organization, but also for clients who are trying to navigate where do I go for help, right? And if there's, ease of entry into a system, we really want to facilitate that as best as possible. And these were conversations around collaboration we tried to have, 10 years ago, 5 years ago, and weren't very successful. And so I think just in this environment, people are way more willing to come to the table and think about ways to work together out of necessity.
Sure. Well, I have one more question for you
Yeah,
before you put
sure.
your microphone down. You sit at that intersection of where donors also are coming to you and asking what can we do. Share with us a little bit about what you've seen for what philanthropy can do beyond writing a check, beyond the funding. What else is it that they're able to do to be able to help the service organizations that are out there?
Yeah,
So what have you seen?
it's a great question. And I loved the phrase you used, sort of the best of times, because I think there is, you have to like call out the bright spots, right, in this moment. And I think just not just the philanthropic community, but just the community. People in Chicago have been stepping up. The amount of just individual donations that we're seeing. Our food pantry back in November had a 25% increase in the number of volunteers like calling to just like, how can I help? How can we, be part of this solution? And we're so fortunate to live in a city that just has such a robust and thoughtful and engaged philanthropic community. It's really quite remarkable. And the philanthropy has come together. We've already flexed really good muscle of working collaboratively together. It's through examples of coming, for foundations coming together to address gun violence prevention, or obviously as part of the COVID response, and now coming together. And so, beyond, of course, being able to provide emergency funding and bridge funding in this moment is really essential. We were able to do that, fortunately, through JUF. We were able to get dollars out the door, to address the food crisis right away in November. But we're also being able to provide what we are kind of referring to as strategic capacity and technical assistance support funds. And I know other foundations are doing something similar. In these moments, organizations need to take the time to do that critical planning, that scenario building, need to think about ways to enhance, efficiencies within the organization. So we've been able to provide some, capacity support dollars, and just time for people to really think about how can we, whether it's logistics, whether by the use of AI, whatever it is, to be able to do some of that, in-depth planning.
That's great. I'm so glad that you're doing that. I'm sure many people here are really delighted to know that is happening. Okay, Lauren, this might be the toughest question of all, because we have Mark being able to lay the foundation of what's happening on the ground, how it is that people are being impacted, both people who are receiving services, receiving the care, but also the people who are providing that care. We're hearing intersectionality of all of that. You, my dear, get to share with us how it is that the state might be able to help out. What is your coalition doing to be able to really address many of the things that are happening? This is coming down the pike. We know we know things that are happening here. We know that there's going to be things in the future. There's recognition that there may be some efficiencies. Where is it that you're seeing? What is it that your coalition is really pushing for or being able to advocate?
Sure. So I'll just mention that Illinois Partners, as a statewide coalition, we have organizations across every type of service in every district in the state. And there's a real common thread of what they're all kind of experiencing. And I think we conduct research. My colleague who's over here, my director of strategic communications, conducts research with Illinois Partners that's rooted in the experiences of providers across the state. And we've been producing a few reports. One, the theme of those reports is federal changes, community consequences, what's happening in real time. And a pervasive theme here is bracing for impact. And while there are organizations, about 90% of the organizations we surveyed get some sort of federal funding in some way. As of our last quarter report, over 25% of those had already experienced losses, with 70% experiencing increased operational expenses. Basically, it costs more now to provide these services, and it was already structurally underfunded for decades. And that's kind of the drum we've been beating, is that human services have been structurally and deeply underfunded forever, because this work isn't valued in a way that it should be. And so all of this confluence of issues, I think for us, I feel really grateful to work in a state that has leadership that's committed to meeting this moment. But we're also in a time where we almost have to completely shift, and we might need to burn it all down a little bit, like, not to sound dramatic, but I think there's a certain opportunity here, which is that the way business as usual has been happening for decades hasn't been working. And we actually need to work together to be able to innovate, to be able to meet needs in real time. And that does require political courage. It requires us to think differently, and it requires us to collaborate. And it requires us to trust the people who've been doing this work for decades, that they know how to do it. And so when we look at Springfield, I think we have a lot of legislators who want to meet this moment and who understand the value of human services. And I think all of us have the great privilege of connecting with legislators who are really passionate about that. But there's a constant refrain of, well, where's the money going to come from? We don't have the money. Where's the money going to come from? And that's why I feel really strongly and very passionately that we also need to be talking about structural revenue solutions to the state's budget problems. And there are opportunities to do that in a progressive way. And there are opportunities to do it in a way that ensures that the wealthy pay their fair share. And so that may feel slightly disconnected to human services. I think especially providers are on the front lines doing this work every day, bogged down by it. And so it's something that coalition leaders, I think, need to continue to take a very public stance around and hold our leadership accountable, both in Springfield, but also in the governor's office, that we need bold solutions to revenue in our state. And that's a huge part of our work and what we're advocating for. I think, for another piece of this too, for providers, is there are actually non-monetary solutions to some of the most pervasive issues with providers around contracting, around timely payments for money that's already been appropriated to human services. And those are actually efficiencies. And providers already know how to be efficient, because they have been stretching the dollar more than anyone for decades. And so what we hope to continue to work with the state on is, what does it look like to actually be more efficient in our timeliness of contracts, in our timeliness of payments for money that's already planning to go out the door? And how do we do that in a way that allows providers to have more flexibility and to meet the moment? And my final thing I'll say around philanthropy is, we're really lucky to have a community of foundations in Chicago that really are well-versed in meeting the moment. They did it during COVID. They're continuing to do it now. But I'd be remiss if I didn't beat the drum about general operating funds. That's the solution, folks, is flexible funding. Nonprofits already know how to do the work. And philanthropy is really, at this point, our only option for that flexibility. And so I just wanted to make that plug, because I feel like I have to in every space.
And I'll just add multi-year.
Yes, multi-year. Yes, exactly. 100%.
Yeah, this is great.
Well, and I want to give a shout out to this entity. It's not really an entity, but it's a whole bunch of funders that got together with millions of dollars, called the Resilient Chicago Fund. Hopefully many of you, in partnership with others, applied for some planning grants like Thresholds did with our behavioral health partners, and with the state, and with Cook County, and with managed care companies. We put together a really comprehensive proposal so we can figure out, as an entity, not as an individual organization, but what we are going to do collectively to make sure that everybody with behavioral health issues, and in Chicago alone, there's probably 60,000 people who are at risk of losing their Medicaid, But we have a plan. We have a really good idea about how to prevent. My goal is that not a single person at thresholds will lose their Medicaid because of these ridiculous work requirements and education requirements. I'm all for work and all for education. Work, we know, is the most important predictor of mental health recovery. That's why we have the biggest supported employment program in the country. But that's not the issue, right? If people lose their Medicaid, that's sort of the end. They will be institutionalized in those 4 institutions that I talked about, which will end up costing the state and the feds a lot more money. But the Resilient Chicago Fund is a really interesting example of funders coming together and saying, we're not just going to do business as usual, and we're going to ask you as providers and policymakers and thought leaders in the community, practitioners, how we can do what we do better and different and more effectively and more efficiently. So really excited about that.
That's great. Okay, I want each of you to respond to this question having to do with responsible budgeting in a constrained year. We're in that moment, right? We know that federal funding passing through the state to nonprofits is limited. You've already alluded to the fact that the state isn't able to make up the difference. And so looking at philanthropy is very helpful, but knowing that isn't, it's very limited. It's not going to solve it. The amount is not sufficient to fill a gap. So what choices will still promote stability and which ones will create avoidable harm? Who wants to go first? Would love to hear from each of you. Is there flexibility? Is it predictability?
Yeah.
What is it that
Well, I just want to challenge, I mean, the state can provide us more money.
Yes, that's true.
Okay.
There's
Good challenge.
decisions, political decisions mostly, that are precluding us. We have a very unfair tax. I mean, that's how I feel. I think the Civic Federation has a different opinion, but I'm just one board member. But the current tax system and what we tax and what we don't tax and who we tax and who we don't tax is not working. We could bring billions more dollars into state general revenue to support community-based organizations if we wanted to. And there's a couple of proposals pending. I think there's a couple of different legislative. And how do you describe it, Joe? There's a lot of, the sirens are singing, the song is more money, more money, more money. You were quoted in Cranes yesterday or today talking about this. And yes, there's a lot of us that are singing that siren song of we need more money. And I'm going to keep singing it. But we also need to use the money that we have more effectively and more efficiently, and especially directed toward community-based services, which are half the cost, get better outcomes, and prevent unnecessary institutionalization of all sorts. So we have to change the way we allocate our scarce resources, and we need more money so that we are not so scarcely
Not being
resourced.
scarce.
Yeah, I would agree with that. And I think there's a perception here that it's incumbent upon providers and nonprofits to be more efficient, when I think we already know, I think those of us that are partnered directly with nonprofits already know how efficient they are. And we also know that some of the hardest, most important, most essential work that saves the state money in the long run. So we have to also look at the cost savings of what community-based organizations offer. That's put on the community-based organizations, not the state. And the state contracts with them, and without additional funding, the state is essentially balancing its budget on the backs of frontline health and human service workers who are on literally the front lines meeting the moment every day. And I think that we are in a moment where we have to radically rethink how this system has been operating. But as I think I alluded to earlier, there are proposals out there that will directly benefit all of the folks who need these services. And it's not just for the sake of, I would say, nonprofit provider existence. It's for the sake of actually meeting the needs of the communities in this very volatile moment. And so I do also want to gently push back on the idea that it's incumbent on providers to try and be more efficient, because every provider and every leader I know of a nonprofit organization is doing things already quite efficiently.
So before we get to Emily and your response, what I'm hearing you say is that there are some things that the state could do that's more efficient. So is there anything that your coalition is doing to be able to help move that along?
Yes, 100%. It's called the Community Partner Fair Contracting Package. And it's right here. If you want more information, it's on our website. And I also alluded to that earlier. It's a series of bills that are really focused on, okay, these dollars have already been designated to community-based human services. How do we make sure we're not taking 9 months to issue that contract while also at the same time requiring organizations to be doing the work, even though they can't be paid for it until they receive their contract and then receive payment for that work? This sounds like an absurd problem, but it literally happens to pretty much anyone at some point in their journey with contracting with the state. And so that's an efficiency issue. It's a technology issue. It's one where we have to be thinking differently, and we have to be thinking in a more innovative way. And so we have 3 bills. They all moved out of the House last week during deadline week, which was a very stressful time. But we have bills around prompt payment, so ensuring that payments come in a timely manner, bills around timely contracts, and then also a bill around the Court of Claims process, which is a black box that if you don't get your payment on time from the state, it ends up in Court of Claims, and then it's just a black box, and you really have no idea when you're actually going to get that payment. And so that it sounds boring. It sounds like very technical, but this doesn't require appropriation to actually implement these kinds of solutions, and it would have immediate benefit, particularly on small community-based organizations who don't have 2 months or more to front the costs of actually providing these services while they wait for their contracts and their payments. So that's one example.
Okay, great.
Yeah.
Emily, one.
No, go ahead.
No, I mean, really, everything that Lauren just said is what we're hearing truly from our agency partners. And I asked them that question very specifically because I was like, okay, I have this opportunity to share this back. And it was around efficiencies at the state level and really just thinking about creative and, different ways, to your point, yes, more revenue, but also thinking about other opportunities to bring revenue in. And I know there's the LIFT bill, which was just unanimously passed. I'm looking at Amy Zimmerman, who's our state policy partner there, but requiring timely transfer of non-probate money that's left at banks to NGOs so that they can get the money out the door faster. So there's, fixes like that. That's small, but something that can really make a significant impact.
Great.
And I think the way that we're working with the state, especially now, and Cook County on HR1, and everything from technology to public service announcements to health navigators, boots on the ground, to information and education. I mean, there's so much stuff. This is a horrible. HR1 is it's the biggest nightmare that I couldn't even, and we're going to figure out how to overturn it at some point in the near future. But in the meantime, we're coming together as philanthropy, as nonprofits, and especially as government to figure out how we're going to do so much better and do it together. So, this is where I am so Pollyanna and so glass half full.
We have to be.
And so full of hope, that these worst crises, I think, can bring out the worst in us or bring out the best in us. And I'm feeling like this is a real interesting moment where the best of the best are coming together.
That's awesome.
So, and we're lucky with the current state administration, the leaders, none of whom are in the room today, but from the governor to the deputy governors to the chiefs of the various divisions and departments, they're on speed dial with many of us in this room, with most of us, and are responsive and are thoughtful and are trying to figure out solutions to problems that they did not create, but they are being forced to solve.
Right.
So I think, and that's another blessing that we have here in Illinois, which also gives me great hope.
That's really good. I do want to get to some questions in the audience. I'm sure that you all have them, but before we get to that, I want to ask one question of each of you. What is it that gives you a little bit of hope for the next 3 to 6 months, and having that time frame really tight, because this is a long tail. It's going to take a long time for this to fully. But what is the one hope that you see within the next 3 to 6 months?
I'll just say that our upcoming research report that is coming out next week is part of this ongoing series of federal changes, community consequences. But instead of this report being all the numbers and the data, which we've already done, this report is called Profiles in Perseverance. And it's profiles of 6 organizations, one of which is New Moms, who's over there. Yes. who shared just, I actually feel a little emotional talking about it, who are meeting this moment every single day in ways that are remarkable, in ways that have required so much resilience that shouldn't have been required, but also that put their clients and their communities first. And those are just 6 organizations that we had the wonderful opportunity to be able to connect with. And that is happening in every community, in every city, in every town across this entire state. And so that's what gives me hope, is the fact that through everything, through, a budget impasse, through COVID-19 pandemic, and now through this administration, organizations are not giving up. And they're continuing to do everything they can to meet this moment. And that inspires me quite a bit.
Great. Emily?
I would say same. It's really the leadership of the nonprofit organizations that have been, as Lauren said, in crisis mode for over 6 years now, and continuing to show up and, continuing to wake up at 4 o'clock in the morning and read those headlines and like have your moment of panic and then figure out, okay, how do I lead in a really clear and focused way that's values driven, that's focused on ways we can best serve the community, and continuing to show up. I think there's, one of the things we're tracking is we're concerned about risk of burnout for nonprofit leaders and staff, and there's real risks there, and maybe we can talk about that or at some point. But just the leadership of the community and the way that we're coming together is really inspiring.
Mark?
Yeah, oh God, everything gives me hope, I gotta say, which is actually a good thing.
3 to 6 months.
Yeah, but Dee Atkins, our Chief of Community Engagement, gives me hope because she's out every day in communities throughout Chicagoland, not telling our story, but hearing the stories of people in the community so that we know how to be a better partner. Amber, who's our Senior Vice President for Public Policy, and goes down to Springfield every week. How you got here today, I have no idea. And you're leaving right after, right? Who is fighting the good fight and telling the story for the sum of us about why investments in behavioral health are so important. And I have another staff person here somewhere, I can't see her, Ariella, who basically works 24/7, 365 as the director of our mobile crisis response program. Boots on the ground, Thresholds never closes, 24/7. And so those 3 people give me hope. But it's the clients, frankly, that get me out of bed every single day. A guy named Joey, Cook County Hospital, 15 times in the ER in 1 year until we met him through our Cook County linkage program. Within a month, we got him into mental health treatment, substance use treatment, and found him a voucher miraculously, hasn't been to the ER once. 6 clients at Northwestern last year. 6 clients had 170 ER visits. In a partnership, just 6 people, 170, in a partnership with Northwestern that was new, including housing for a small program called a Safe Haven, which is low barrier housing that they help fund. 6 clients got housing and case support from Thresholds, 0 emergency room visits among those 6 clients in the past year, 0.
That's phenomenal.
So that's what gives me hope, because we know what works. We don't need another gosh darn research study on housing or healthcare or case management. I appreciate them. Illinois did a great study recently that gives me great hope. Denver last year did another path-breaking study on the effectiveness and cost effectiveness of housing, blah, blah, blah. We know all this shit. We need to continue to fund and support what works. And that gives me hope.
That's fantastic. I do want to know if there are questions in the audience. I'm sure there are. One here and then.
You can hear. So I think everyone can hear me, right? So, Mark, I'm so glad you raised the collaborative issue around HR1, around SNAP and Medicaid. We have these 2 gigantic boulders coming at us, right? Which, and you noted philanthropy, and we're seeing collaboration on, for example, I think CCT has done something, Matt Bruce said, in terms of like online training.
Right.
What can the role of the corporate community in Chicago or in Illinois be? People only need to make, I was shocked by this, $560 a month, right? Because that's the federal minimum wage, to get 80 hours worth of work. So we're seeing philanthropy. We're obviously seeing wonderful people from the nonprofit community. What would you be asking of the corporate community?
Okay, and for those who weren't able to hear, question is how can the corporate community step up as much as the nonprofit community is in the collaborations that we've discussed so far? Any ideas about what you would recommend for corporate community to step up?
Sure. I mean, I think there's so many examples of where corporate Chicago is stepping up big time in the work to end violence, especially. I can't imagine that we would be as far as we are without public investment and without the enormous corporate investment in I believe it's hundreds of millions of dollars. The work that Brian Fabes and the Corporate Coalition are doing inspires me every single day, bringing corporate leaders to the table to figure out how to expand job training and internships and hired positions and paid internships. I would love the corporate community to be even more involved in the public policy advocacy on the issues that we care about. I know it's hard to get out of your particular lane, but I think there's a lot of common ground there. I am so grateful to the many corporate board members that we have at Thresholds, from the banks to Deloitte to the hospital systems that are giving their time, talent, and treasure to places like us, and hopefully to every single nonprofit, including the Civic Federation. So I think the opportunities are great. I think we can't divide I think we live in silos, and I think silos are what hurt us and eventually kill us. But figuring out how to better bring and even better bring our corporate partners to the table. And we try to do it every single day.
Yeah. I will say really quickly that I also think it's so valuable when the private sector and corporations talk about the ways in which human services matter to them, the ways in which they have relied on human services in their life. I think childcare is a real example that has that very linear connection of childcare is so essential for people to come to work. So that's one example, but being really vocal about how human services matter to their employees, they matter to the communities, their clients, all of these different pieces. I think hearing that from the corporate sector actually makes a big difference and matters quite a bit.
I was just going to say, I mean, this isn't like an us and them. I mean, this is truly, corporations' employees are being impacted by these policies, right? We've seen that and we know that. And so it can't just be something that, well, this doesn't impact us specifically. So I think, making those connections is really, really important.
Yep. Yeah. Good.
Yeah, and really quickly, when corporations step up, so Starbucks a couple of years came to us, thanks in part to Sean at the United Way, because they were looking for a partner in Chicago that could help solve a challenge at Starbucks with an overrepresentation, if you will, of people struggling with homelessness and pretty serious mental health challenges. But instead of kicking them out of the store and kicking them out of the bathrooms and putting up a sign, "We don't want you," they wanted to figure out how to welcome and how to have baristas and the community welcome them into the store and get them to the place they needed to be. Because being at the Starbucks all day is not the answer for any of us. And so they invested in us over the last couple of years to the tune of hundreds of thousands of dollars, where we had a specific Starbucks team frequenting the 17 or 19 busiest Starbucks in Chicago, mostly along the lakefront, but from Rogers Park to South Shore. And what a difference it made. Made a difference for the company, made a difference for the clients who were coming in, made a difference for folks who eventually became our members or clients of other social service organizations. So I just think there's so many innovative ways that companies can step up. And it takes money, right?
Yeah.
You got to invest to see the change that you want.
There was a question here. Do you still want to ask it?
Yeah. Do I need the?
Yeah.
Hi, is that better? I wanted to ask, this is more of an operational question, but the theme today seems to be both crisis and opportunity colliding at the same time. How do you balance your staff and keep them motivated and show them that we have the positive parts as well as the negative? The 4 a.m., wake up, $2 billion gone. That takes the day. How do you let them know that not every day is like that and there are the good things that they can look forward to make sure that they don't get burned out, to your point?
No, I'll wait. I'll come last because it's a great question. Thank you.
I do think, and actually Mark can speak to this, I think as a leader of a nonprofit that has so many employees that are on the front lines every day. But I think the most success we've seen is organizations that put time and energy into how do we both show our team members that we value them, and putting that culture not as an afterthought, but as a primary priority. And there are a lot of nonprofit organizations that are doing that, again, with scarce resources when they're trying to, meet the moment every day. And I don't want to romanticize and say, oh, it's like simple or easy, but it takes courageous leadership that sees culture and valuing the work that's being done as a core pillar of their work actually being able to be done in community. But I think Mark can probably speak to this.
Yeah, I could speak to it, but because I have CEO privilege, I might just call on like Dee or Ariella, somebody from Thresholds, to answer the question. How do you see it? I mean, from the non-CEO seat, because it's a great question, and I definitely, and to see if we agree, we might not.
Thank you, and good morning, everyone. It is a great question, and I can easily respond to it by saying effective communication is paramount. And in Thresholds, there are a lot of us, and Mark he does get the first news at 4 a.m., but the way that he speaks to our organization through his email communications, most people don't know that he is on site at many of our near 65 locations that we have throughout the Chicagoland area, talking specifically to staff. That's very encouraging, especially when you're doing work that's boots on the ground. Even in the C-suite, we and Amber, you now know this, that we're on the phone almost every day of the week at 8 a.m. talking, we're communicating. So the best way that I can put it is that when you have people that are doing the work, it's really important that you talk to them. We don't shy away from what's going on, what's seriously going on. And inside of that, making sure that they have room to breathe, because this work is not easy. And so it's important that they also know that while they're doing the work that they're compassionate about, that there is space for them to be able to just breathe through it all. Thank you.
That's great. Let's see, I think there's probably time for one more question. You right here. Here's
I'll
my-
defer to the gentleman back
Okay. Let's get a microphone.
Thank you all. Jerry Hawkins, Chicago United for Equity. I have a couple larger questions. I heard you all talk about, the wealthy paying their fair share. But I'm thinking about a both-and approach, and I think it's connected to maybe a larger narrative strategy. And that is, when the federal government ceased to do their work historically, the wealthy actually stood in the gap and particularly upheld civic institutions. We can think about Julius Rosenwald and even locally, Montgomery Ward, right, protecting the lakefront for the poor. So I'm interested in how we can help the wealthy understand their responsibility to our civic institutions, particularly when the federal government is failing. And secondly, you all also mentioned COVID-19, and you all mentioned the current issues that we're in. But also during COVID-19, there was a reckoning where almost every nonprofit, corporate institution, and philanthropy realized that they were failing Black people and recognized that and made pledges and acknowledgments, and mostly all of them have rescinded those acknowledgments and pledges. So in this time, the federal government is explicitly attacking Black residents. So I'm interested in what you all are thinking about when you are doing your work out in the community, knowing that this is really actually happening.
Well, there's a lot of questions in there. I can't tackle them all, but I'll address just very briefly DEI. We have a lot of good swag at Thresholds, really cool hoodies and t-shirts. that are available at our store online. But my favorite is DEI is our DNA. That's what it's been at Threshold since 1959. We can't do this work unless we acknowledge the diverse clientele and the diverse communities we serve and the diverse staff that it takes to serve well the clients that we serve. You know that the outcomes for Black and brown people and for the LGBT community are much better: health, housing, mental health, et cetera, social determinants of health, when they have providers and caregivers and mentors that look like them and that have that lived experience, including people with mental illness. About 20% of our staff identify as people with lived experience of mental illness. That is what diversity is for us. It's about bringing all the people to the table that need to be at the table. And you don't sort of know what you need until you look around the table and see what you don't have. Equity, again, that is what we get up every day to do, because of the inequities and the historical inequities of 400 years or longer that have kept poor people poor and Black people poor and discriminated against, imprisoned, et cetera. And for me, it's all about inclusion and belonging. So despite all of the federal, I'm not even sure what the word is, demands that we stop being who we are, we will not, we cannot. And if that makes us a target, we have to figure out how to deal with that and live through that. And we may have to change language. Dee's always the first to say, well, if we change words, but we do what we say we're gonna do, and we do it with the same intent and with the same impact and the same outcomes, let's be flexible, but never ever compromise our values. And our values are deeply rooted in all things DEI. And then you can talk about how to get corporations to fill the gap.
Oh, I mean, I think also, one of the things we haven't talked about is just the role of faith communities also in this work. And as a Jewish organization, really leaning into our Jewish values, which we were founded on and which really drives our work. And I think, kind of always as an organization coming back to that as we're engaging donors. And, our board also, probably similar to the Civic Federation, has a variety of different diverse opinions and political leanings. And so, but always coming back to what is core and essential for the mission of our organization, the mission of the organizations that we serve, and why we do this work, right? Which is about creating a better world and doing the most good together on behalf of the community. So I do think it's important. We do a lot in terms of education, especially with donors maybe who, maybe are reading the headlines but aren't feeling as directly impacted by what's going on. We haven't also talked about, there's so much we could have talked about today, but the ICE presence and the increased ICE presence and the impact that took and the toll that took on all communities in Chicago and why that matters and why, as communities, we need to stand up, and as leaders in the community, we need to stand up on these issues. So it is an ongoing part of the work, and thank you for raising that.
Yeah, I'll also just say that the pushback is real, and nonprofits aren't immune from the ebbs and flows of the cultural zeitgeist of what matters. And I think I really just want to acknowledge, and I'm sorry, I can't see you because of the pillar, the idea that there was a huge trend in 2020, and there's now been so many steps backwards. And I think it's really important to name that. And it's really important to not pretend like that hasn't happened, because it has. And at the same time, thinking through what does it look like, and what do we stand to lose to not back down from our values and to not walk back what we said we were going to do. And that is it's an individual choice to every leader and every leadership team and every organization. But I will say that I'm deeply inspired by the many, many organizations in our coalition that are not backing down and that are naming these issues in real time. There's a new issue out of the General Service Administration that's requiring a certification that you basically agree if you get a federal grant, that you will adhere to the new executive orders around DEI. And thousands of organizations, many of whom who get federal funding, signed on to say, no, we're not going to do this, and we're not going to change what we do, and we're going to tell you why this is not how we operate. And I think the more we can do that collectively, and the more we can speak with that collective voice, we're going to see and continue to see that tide shift back. But it requires, again, political courage. So.
This is excellent. I appreciate what each of you have shared today. I love that we ended on that question because we were able to get to some topics that I think are really critical. So thank you all so very much for being here.
Thank you.
I appreciate it. And I will put a little plug for Civic Federation. Continue to follow on LinkedIn. Be cognizant of all of the policy papers that come out, because there is a lot of information concisely and easily consumable by each of you in reading it.
Thank you all so much. Nope. Thank you to the four, Kristin, Lauren, Emily, and Mark. Thank you all for coming. You're welcome to stick around and chat for a little bit, but have a lovely rest of your day. Thank you.
Thank you.
Thank you all so
Great.
much.
Thank you. Thanks for having us. Thank you. You were wonderful. You guys are so great. So lucky. So lucky to be with you. What a way to start my day. So yeah, so inspiring. Hey, my mic is still on. Thank you. I don't want to be hot mic'd here telling people I love them, and